Welcome to another episode, Bodine Ledden. I'm joined by Shaun Brewster. And this is an interesting topic about an experience that Shaun had receiving a massage. And we want to just talk through some of the common themes and things that may pop up and things that you maybe should do and maybe shouldn't do in a consultation. So, Shaun, walk us through your experience.
Yeah. So this happened just today. In fact, I had a spare day while I was teaching, traveling, and I thought I'll book myself in for a massage, head out, get a few little niggles sort of under control, and maybe relax for a bit and enjoy this session. And you and I will often go and get a massage when we're away teaching, and it's a good experience and a great opportunity for us to meet other therapists and learn from them and see how they do things. And this was an interesting one, and this is not to pick on the therapist that gave me a treatment, but I thought there's a lot of teaching points, a lot of teaching opportunities, learning opportunities in this experience today. So I thought we'd chat about it. So I booked in for this massage, and it was generally a sort of therapeutic style massage, not too clinical, and that was okay. I'm just happy just to go and enjoy the session. And I was really struck initially by the fact that I didn't really get asked any questions prior to the treatment, and even with a therapeutic style massage, typically the therapist will ask questions like, okay, do you have any pain? Where is it? Can you point to it? When does it bother you? What makes it worse? What makes it better? Blah, 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 all these sort of standard things. And then from there, maybe they'll do a bit of an observational assessment or movement assessment. And then at a very basic level, you jump on the table and away you go. And that's fine, right? I was greeted by a very pleasant therapist, and I'd pre-filled a form online and told her that I'd had some pain in my lower back or some tenderness in my lower back. And she mentioned, okay, so you have some soreness in the lower back. And I said, yes. And I went to indicate where it was. Little to no interest in the location of the pain. And then very quickly moved on to the next thing, which was just telling me how the session was going to work. And we've probably all experienced a session like this before, where the therapist is really not that interested in the patient or their presenting situation. They're more interested in getting them on the table so that they can do what they do. And I guess this is the biggest difference between a clinician and a technician, right? The technician might be very good at the skills, but they're not at all tailored or geared towards the desires or even the needs of the patient. And that was definitely my experience today.
Yeah. And how important is that, just to understand that patients want to be listened to. They want to
Yep.
be able to explain and tell their story. It's often the perception of therapists that, I've got to get in there and do something to them. Well, not always. I mean, that's certainly a component, but often they want to be listened to and felt like they've been heard. I think that's really important. When we look at this integration of this biopsychosocial framework into what we do with manual therapy, we've got to understand that. And as simple as even going through a physical assessment. Oh, yep, they touched me, they figured out where my limitation was or where my pain was, and then they could sort of structure a treatment plan that was more specific to my needs. I think that's super important.
Yeah, that's right. And a classic example of how that plays out in our normal life outside of the clinical setting is if we've got some stress or a problem going on in our life, we'll go to a friend or a family member and we'll sit and we'll talk about it. They don't always have to have a solution for us. They don't have to give us answers. Just having someone who's interested in our experience often unburdens us of that experience, of the negative outcomes of that experience. And that's so much a part of the therapeutic alliance, the therapeutic exchange, is this listening, asking questions, absorbing information, reflecting back that we've understood it, even if we don't know as the practitioner, even if we don't know what to do, even if we don't know what the solution is. Somebody might come in with a complex presentation that's outside of our scope, something we can't manage or understand. The fact that we sat and listened to them and nodded and showed interest is therapeutic in itself. There's so much benefit from that, like you're saying. So this experience, while it was a very nice massage, and I did nod off to sleep a couple of times, and I had a relaxation benefit, that aside, I walked out of there going, she really didn't care much about me as a person, right? And that sounds like a very new age kind of selfish kind of thing to say, but I wanted someone to go, okay, what can I help you with? That would have been a great place to start. What can I help you with today? Wasn't asked. And I think we just need to remember as practitioners that really basic stuff about communication and listening and understanding what the person is there for, even if we don't have a solution for them, is so important.
Yeah, and it's that whole multifactorial nature, right? We can't have our blinkers on and just have tunnel vision. We've got to think about all of these other things that can be involved. And, like you said, with just being able to tell the story, there is research on that to show that people that just after telling their story without any intervention whatsoever, they've had changes in pain pressure threshold. So, that just telling your story can have a therapeutic effect.
Yeah, definitely. And so I hope that people hear this or watch this and go, right, I'm guilty of this sometimes, because I know that Bo, you and I can certainly put my hand up and say, right, I've had patients come in and they've gone, I've got XYZ problem. And without too much assessment or without too much conversation, I've gone, I know what to do. And I throw them on the table. And this is the other clinical side of it, right? Like, chuck them on the table. I'm going to do my thing because I'm good at this. I know how to fix this problem. But while that might get results sometimes, the bit that we skip is the bit that often is most important to the patient. It's that listening. It's the exchange. It's having them understand that, yes, I was heard. This is someone who cares about me. They actually want the details. And we often, speak negatively of GPs who have such a small time frame to work within, and they're just ticking boxes so that they can then prescribe the medication or refer off or whatever they want to do. And that's the limitation that you have in that clinical setting. But for most manual therapists, we have a bigger block of time. And we often think, okay, well, that block of time should be filled with activity, filled with application. It doesn't have to be. If you've got an hour or 45 minutes or 30 or 20, whatever it is, it may be that the patient will benefit most from 90% of that being listening. Actually just having someone listen and actually care about you and what's going on with you, that could be the most beneficial thing for them on that day.
Yeah, I agree. And that's why I thought this was a really great story. We've got to integrate so many different things into a treatment, and not just a specific intervention or doing something to them. And I really like that point that, we don't have to always provide them with an answer or a diagnosis. Often it's there to support them along their journey, and encourage them, promote movement, activity, and other influences that may be affecting their pain experience. And that's really the power of that listening and communicating with them.
Yeah, definitely. All right. I think it's just a short episode, this one, but I think it's just a really good story to highlight that very important thing about the importance and value of being heard and being part of that exchange with the patient. And it was just really highlighted to me as the patient today. And so I can't recommend this more highly, which is, go out and get treatments from people, not just for the experience of receiving that modality and that, the skills and knowledge from the practitioner, but so that you can reflect on what it's like to be a patient. So you can learn from the practitioner. Maybe they're doing all the things right. Maybe you'll be able to pick out a couple of things they could have done better. Take that as a learning opportunity for yourself and go, right, I'm going to integrate that into what I do and make sure that I spend more time engaging with my patients and asking questions, and make sure they get an opportunity to say all the things they want to say, get it off their chest, get it off their mind, out of their nervous system, out of their experience. And so that we can sort of take them and go, right, now you're ready for the physical treatment. Now you're ready for the advice, for the exercise, for the assessment, whatever it might be. Because until they get to that point, you might be rushing them through a process that they haven't quite finished yet.
Yeah, definitely.
Yeah, cool.
Excellent. That was great. Thank you very much, Shaun.
Pleasure. Thanks for listening, everyone.
Cheers.